Welcome to Study Nurse IQ. Today we're diving into one of the most crucial skills in nursing practice: effective communication. As healthcare professionals, our ability to communicate can make all the difference in patient outcomes. Communication isn't just about what you say, it's about how you say it, how you listen, and how you connect with your patient. We'll break down the communication process, therapeutic techniques you must use, and the non-therapeutic ones you should always avoid. Let's get started. The communication process and levels. At its core, communication is a process. It has four key components: sender, the person initiating the message; receiver, the person who gets the message; message, the information being sent; feedback, the receiver's response to the message. Think of it like a text message. You, the sender, type a message to your friend, the receiver. The words themselves are the message, and their reply is the feedback. Now let's look at the different levels of communication. Intrapersonal. This is communication happening within yourself. It's your own thoughts and internal monologues. Think of the A in intrapersonal for alone. Interpersonal. This is communication between two people. Small group. Communication with a small group of people, like a team meeting. Public. Communication with a large group, like a presentation. Nonverbal communication. Did you know that most of our communication is nonverbal? Nonverbal communication includes our body language, gestures, and expressions. As nurses, we must be aware of how our nonverbal cues affect our patients. Posture. Leaning forward can show you're engaged. Crossing your arms can signal that you're closed off. Your face can convey boredom or genuine interest without you saying a word. Eye contact. This is a big one. While eye contact can show engagement, remember to be culturally competent. In some cultures, prolonged eye contact can be seen as disrespectful. Touch. A hand on the shoulder can be comforting, but only if it's appropriate and the patient is receptive. Always be mindful of boundaries. Here's a quick memory trick for effective nonverbal communication. Roles. Relaxed body language. Open posture. Lean in. Eye contact. Sit squarely towards the patient. Developing a therapeutic relationship. Therapeutic communication is built on a foundation of a strong nurse-patient relationship. Here are the key components of building that trust. Use the acronym GERTRUDE to help you remember. Genuineness. Be open, honest, and real in your interactions. Empathy. This is a crucial skill. It's the ability to see the situation from your patient's perspective without taking on their feelings. We should never confuse this with sympathy, which involves feeling the other person's feelings and is considered non-therapeutic because it can cloud your judgment. For example, if a patient is angry, an empathetic response is, "I understand you feel angry," while a sympathetic response would be, "I can't believe how your family is treating you. I'm angry for you." This is a special feeling between you and the patient based on acceptance, warmth, friendliness, and a non-judgmental attitude. Trust. This is built through consistent actions like providing a blanket when the patient is cold or following through on your promises. Respect. This means believing in the dignity and worth of every individual, regardless of their behavior. Always call the patient by their name and preferred title. Therapeutic versus non-therapeutic communication. This is the most highly tested section. Therapeutic communication is crucial for building trust and getting the information you need. Non-therapeutic communication can shut down a conversation and make a patient feel judged. The do's of therapeutic communication. Therapeutic techniques are a collection of skills that prioritize the physical, mental, and emotional well-being of your patients. These techniques include using silence. This is a powerful technique. It encourages the patient to organize their thoughts and allows them time to think and put their feelings into words. Accepting. Simply conveying an attitude of reception and regard shows the patient you hear them. Giving recognition. Acknowledging and indicating awareness is better than giving a compliment, which can be seen as judgmental. Self. This means simply being present for your patient. "I have a few minutes, I can sit here with you." Giving broad openings, general leads. This allows the patient to direct the focus of the conversation, emphasizing the importance of their role. Placing event in time or sequence. Identifying the order of events helps the patient organize their thoughts about their experiences. Making observations. Verbalizing your observations about a patient's behavior or appearance can encourage them to talk about what's going on. Restating. This involves repeating the main idea of what the patient said back to them to confirm your understanding. If a patient says, "I can't sleep because I'm so anxious," you can say, "So your anxiety is keeping you up at night?" Reflecting. This is when you refer questions and feelings back to the patient so they are empowered to actively engage in problem solving. Focusing and exploring. Focusing is about honing in on a specific point. Tell me more about this specific point. Exploring is about getting more detail about a situation. Please explain the situation in more detail. Seeking clarification. Use phrases like, "I'm not sure that I understand. Would you please explain?" "I understand the voices seem real to you, but I don't hear any voices." "I find that hard to believe." Verbalizing the implied. Putting into words what the patient has only hinted at or said indirectly. Formulating a plan of action. What could you do differently if you are faced with this situation in the future? Non-therapeutic communication, the don'ts. These techniques can hinder communication and damage the nurse-patient relationship. Example: giving false reassurance. Never say, "Everything will be fine." You can't promise this, and it belittles your patient's feelings. Asking, "Why?" This is a huge one. Avoid questions that start with why, because they can make patients feel defensive and judged. For example, "Why didn't you take your medication?" Giving advice. You shouldn't tell your patient what they should or shouldn't do. This implies that the nurse knows what is best. Defending. Defending what a patient criticizes implies they have no right to express their opinions. Using denial. This blocks discussion and prevents the patient from identifying and exploring their difficulties. Rejecting. Refusal to consider the patient's ideas or behavior. Probing. Pushing for answers to issues the patient does not wish to discuss. Belittling feelings. Dismissing the patient's feelings as unimportant. Making stereotyped comments. Using cliches or trite expressions is harmful and meaningless in a therapeutic relationship. Remember, communication is a skill that takes practice. A great tool to improve is a process recording, which is a written report of your verbal interactions with a patient, often used by students to analyze and improve their communication techniques. NCLEX-style questions. All right, let's put your knowledge to the test with 3 NCLEX-style questions. Question 1. The nurse is communicating with a patient who is anxious about an upcoming procedure. The nurse says, "I will sit with you until your family arrives." This is an example of which therapeutic communication technique? Restating. Offering self. C. Presenting reality. Open-ended question. Correct answer B. Offering self. Rationale. Offering self is a therapeutic technique where the nurse makes their presence available to the patient to provide support. Restating involves repeating the patient's words. Presenting reality corrects a misconception, and an open-ended question encourages the patient to elaborate. Question 2. A nurse asks a patient, "Why didn't you tell me you were in so much pain?" The patient becomes quiet and withdrawn. The nurse recognizes that asking this type of question is considered a form of restating. B. A therapeutic communication technique. C. A non-therapeutic communication technique. An example of offering self. Correct answer C. A non-therapeutic communication technique. Rationale. Asking why questions can make a patient feel defensive and judged, which is a key characteristic of non-therapeutic communication. It can shut down the conversation and damage the nurse-patient relationship. Question 3. A patient tells the nurse, "I'm so worried that my surgery won't go well." The nurse replies, "Don't worry, everything is going to be just fine." This response is an example of false reassurance, presenting reality, offering self, restating. Correct answer, false reassurance. Rationale. The nurse cannot guarantee that everything will be fine, and making this statement is a form of false reassurance. This is a non-therapeutic communication technique because it invalidates the patient's feelings and provides a promise the nurse cannot keep. I hope this review on communication was helpful for you. If it was, please give it a thumbs up and subscribe to our YouTube channel. Thanks for watching and happy studying.